Chapter 15, Muscular System. Let's discuss the structure and function of the muscular system. Let's explore the different types of muscles in the human body and their unique roles. Skeletal muscle is the most familiar type. It contracts on demand, allowing us to maintain posture and perform movement with precision and control. Think about when you lift a book or take a step. Your skeletal muscles are hard at work. Cardiac muscle operates without conscious thought. It powers the rhythmic contractions of the heart, pumping blood throughout the body 24/7. You don't have to think about it, it just works. Smooth muscle is also involuntary and serves critical functions in the body. For example, it powers the movement of food through the gastrointestinal tract, ensuring digestion proceeds efficiently. Let's dive into the 5 key functions of skeletal muscle. Can anyone identify them? That's right, skeletal muscle is responsible for movement, posture, generating body heat, assisting in respiration, and enabling communication, such as speaking and gesturing. Now, let's look closer at the structure of skeletal muscle. This type of muscle is attached to one or more bones and is also known as voluntary muscle. Why do we call it voluntary? Because it operates under conscious control. You decide when to move it. Muscle cells are so long that they're often called muscle fibers. Each skeletal muscle is made up of bundles of muscle fibers, along with blood vessels, nerves, and connective tissue sheets. These connective tissues hold everything together and connect the muscle to the bone. Take a look at the figure here, showing how skeletal muscles function during contraction. This movement is key to enabling all the amazing things your body can do, from walking to lifting weights. So, what's inside these muscle bundles? That's right, muscle fibers, blood vessels, nerves, and connective tissue. All these components work in harmony to perform those 5 critical functions of skeletal muscle. Let's discuss some important characteristics of skeletal muscle and its unique structure. First, what are striations? Striations are the alternating light and dark patterns in skeletal muscle fibers caused by protein filaments arranged in a specific pattern. If you look at the figure here, you can clearly see the structure of skeletal muscle and how these striations give it its distinctive appearance. Now, let's talk about muscle growth and decline. Have you heard of the terms hypertrophy and atrophy? Hypertrophy occurs when muscles enlarge due to exercise. Think of weightlifting. Those repeated movements build muscle mass. On the other hand, atrophy is the wasting away of muscle, often due to non-use or extended periods of inactivity. Here's an interesting fact. By the time you reach late childhood, you've already stopped adding muscle fibers in numbers. From that point on, muscle growth is all about increasing the size of the existing fibers, not creating new ones. When learning medical terminology, one of the most helpful strategies is to focus on the suffix of a word. Knowing the suffix often gives you a clue to the term's definition. Let's break down a few common suffixes. Trophy means nourishment or growth. For example, hypertrophy refers to the enlargement of muscle fibers due to nourishment or exercise. Stalsis means constrict or contraction. You'll see this in terms like peristalsis, which describes the wave-like muscle contractions that move food through the digestive tract. Striate means stripes. This is used in words like striated muscle, referring to the striped appearance of skeletal muscle under a microscope. Let's discuss muscles and tendons of the upper and lower extremities. Let's take a moment to review the muscles and tendons that make up the shoulder girdle and rotator cuff. The shoulder girdle consists of several key muscles that provide support and movement. Trapezius helps lift the shoulder and stabilize the scapula. Deltoid covers the shoulder and allows for arm abduction. Pectoralis major is a chest muscle that is responsible for flexing, adducting, and rotating the arm inward. Latissimus dorsi is a broad back muscle that helps extend, adduct, and medially rotate the arm. Now, let's focus on the rotator cuff. This group of 4 muscles and their tendons stabilize the shoulder joint and enable a wide range of arm movements. Supraspinatus is located at the top of the shoulder and helps lift the arm. Infraspinatus assists with lateral rotation of the arm. teres minor is a small muscle that also aids in lateral rotation. Subscapularis is positioned on the underside of the scapula and rotates the arm medially. Let's analyze the image and discuss the muscles of the shoulder and arm. I'll ask some questions as we go along. What is the shoulder muscle? The muscle here is the deltoid, which is responsible for lifting the arm and providing shoulder stability. What is the chest muscle? That's the pectoralis major, which assists in arm flexion, adduction, and inward rotation. What single muscle is located on the back of the arm? The triceps brachii is located here. It's responsible for extending the elbow and straightening the arm. What three muscles are on the front of the arm? These are the biceps brachii, brachialis, and brachioradialis. The biceps brachii flexes the elbow and assists in supination of the forearm. The brachialis is the primary flexor of the elbow. The brachioradialis aids in flexing the elbow, especially during quick or powerful movements. Let's also discuss the movements associated with these muscles. The deltoid helps with shoulder abduction, moving the arm away from the body. The pectoralis major is involved in arm flexion and bringing the arm across the chest. The triceps brachii allows for elbow extension, such as when pushing or throwing. The biceps brachii, brachialis, and brachioradialis work together to flex the elbow, bringing the forearm toward the upper arm. What are the three muscles located on the front of the arm? These are the biceps brachii, brachialis, and brachioradialis. Now, let's explore the movements associated with each of these muscles. Biceps brachii is primarily responsible for elbow flexion, bending the arm at the elbow. It also assists in forearm supination, which is the movement that turns the palm upward. Brachialis is positioned underneath the biceps brachii. The brachialis is the primary flexor of the elbow. It works independently of the position of the forearm, whether pronated or supinated. Brachioradialis plays a role in elbow flexion, particularly when performing quick or forceful movements. It is most active when the forearm is in a neutral position, such as during a handshake. Now, let's dive into the muscles of the forearm and how they enable the movement of the wrist and hand, along with key structures that provide support and flexibility. The muscles of the forearm have critical functions. These actions rotate the forearm. Supination turns the palm upward, like when holding a bowl of soup, and involves the supinator muscle. Pronation turns the palm downward and is controlled by the pronator teres and pronator quadriceps muscles. Additional movements bend or straighten the wrist and hand are called flexion and extension. Flexion involves muscles like the flexor carpi radialis, while extension relies on muscles like the extensor carpi ulnaris. Medial movement are movements toward the body's midline and is achieved by adductor muscles. Lateral movement are movements away from the body's midline and is controlled by abductor muscles. Tendons of the forearm muscles are surrounded by synovial sheaths, which reduce friction and ensure smooth movement. These tendons are secured at the wrist by a retinaculum, a thick fibrous band that holds them in place and prevents bowing during movement. Thenae eminence are rounded, muscular bulge at the base of the thumb, which enables thumb movement and dexterity, critical for grasping and pinching. Hypothenae eminence are located on the palm side of the hand near the pinky finger and facilitates the movement of the pinky and supports grip strength. Dorsum is the back of the hand, where the tendons of the extensor muscles are visible. They allows extension and delicate positioning of the fingers. Let's discuss the muscles of the pelvic girdle and lower limb. The gluteus maximus is the largest and most superficial muscle, forming the buttocks' contour. It extends and externally rotates the hip used in climbing stairs, running, and standing from a seated position. The gluteus medius and minimus lie beneath the gluteus maximus and are involved in stabilization. These muscles stabilize the pelvis during walking and assist in abduction. The iliopsoas, which is comprising the iliacus and psoas major, is a deep muscle connecting the lumbar spine and pelvis to the femur. This muscle flexes the hip, enabling activities such as walking and running. The adductors, composed of longus, brevis, and magnus, run along the inner thigh, attaching the pelvis to the femur. The adductors pull the thigh inward and is crucial for maintaining balance and controlling leg movement. Here we have more muscles of the thigh. Quadriceps are composed of 4 muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. These muscles converge into the quadriceps tendon, which attaches to the patella, aiding in knee extension. Hamstrings are located on the posterior thigh and include biceps femoris, semitendinosus, and semimembranosus. These muscles are responsible for knee flexion and hip extension. Let's take a closer look at the muscles and tendons of the lower leg using the image. The gastrocnemius muscle forms the large, visible part of the calf. It's responsible for plantar flexion, or pointing your toes downward, and also helps with knee flexion. You can easily locate your gastrocnemius muscle by standing on your toes. Feel the tension in the back of your lower leg. Next, we have the Achilles tendon, which connects the distal end of the gastrocnemius and soleus muscles to the calcaneus, or heel bone. It's the strongest tendon in the body and plays a vital role in activities like walking, running, and jumping. Together, the gastrocnemius and Achilles tendon work to propel the body forward, enabling dynamic movements like sprinting and leaping. These structures are located at the back of the lower leg and ankle. They are essential for mobility, but they're also prone to injuries like strains or tears, which can significantly affect movement. Let's explore some common medical terms and their definitions. The heel bone is medically termed the calcaneus. It is the largest tarsal bone and serves as the foundation of the heel, playing a key role in supporting body weight and enabling movement like walking and running. The action of moving toward the midline of the body is called adduction. This movement brings a body part, such as an arm or leg, closer to the centerline of the body. A muscle that moves the thigh toward the midline is known as an adductor. These muscles, located on the inner thigh, are responsible for stabilizing the pelvis and assisting in movements like crossing the legs. The major muscle in the back of the lower leg is the gastrocnemius. This powerful calf muscle is crucial for plantar flexion of the foot and helps propel the body forward during activities such as walking, running, and jumping. Let's discuss the disorders and injuries of the muscular system. Fibromyalgia is a condition affecting muscles and tendons throughout the body. It's characterized by chronic pain, fatigue, and tenderness in localized areas. Commonly affects individuals of all ages, but is more frequent in middle-aged women. Polymyalgia rheumatica is an inflammatory disease of muscles causing pain and stiffness. It typically affects both sides of the body, especially in the shoulders, neck, upper arms, buttocks, and thighs. Often seen in individuals over the age of 50. Myasthenia gravis is a chronic autoimmune disease. It causes varying degrees of weakness in the skeletal muscles. It affects the communication between nerves and muscles, leading to difficulty in voluntary muscle control. Muscular dystrophy is a group of hereditary, progressive disorders that impact skeletal muscles. Signs typically appear in boys around age 3. It results in muscle weakness and loss of muscle mass over time. Let's discuss some of the common signs and symptoms associated with skeletal muscle disorders. Soreness is a common symptom that often follows vigorous exercise, especially when muscles are not accustomed to the activity. It's your body's way of adapting to new or intense physical exertion. Next, we have cramps. These are sudden, painful contractions of a muscle or groups of muscles. Cramps are often caused by dehydration, overuse, or an imbalance in electrolytes. Strains can range from a simple muscle stretch to a partial or complete tear. Symptoms of a strain include pain, swelling, and a reduced range of motion in the affected area. Rhabdomyolysis is a serious condition involving the breakdown of muscle fibers. This can release muscle fiber contents into the bloodstream, potentially leading to kidney damage. Tendinitis often occurs with repetitive use of the wrists and hands. It is an inflammation of the tendon and its surrounding sheath, causing pain and limiting movement. Lastly, let's talk about Achilles tendinitis. This results from a small stretch injury to the Achilles tendon. It causes swelling and pain, particularly during physical activity. By understanding these symptoms, you'll be better prepared to identify and manage skeletal muscle disorders effectively. Let's discuss some common conditions affecting the rotator cuff and shoulder joint. Rotator cuff tears are often caused by wear and tear due to overuse. These tears can range from partial, where the tendon is damaged but not completely severed, to complete, where the tendon is fully torn. Tendinitis of the shoulder joint occurs when the tendons become inflamed, usually as a result of repetitive overuse or strain. This condition can lead to significant pain and reduced mobility in the joint. Bursitis, another common shoulder condition, involves inflammation of the lubricating sac, or bursa, within the rotator cuff. Overuse of the shoulder is a frequent cause of this painful condition, which can make even simple movements difficult. Lastly, we have lateral epicondylitis, more commonly known as tennis elbow. This condition occurs when the tendons attached to the lateral epicondyle of the humerus become inflamed due to repetitive strain or overuse. It causes pain and tenderness on the outer part of the elbow, especially during gripping or lifting activities. By understanding these conditions, we can better identify and manage symptoms to maintain shoulder health. Let's take a moment to discuss some common disorders of the wrist. First, we have ganglion cysts. These are fluid-filled sacs that develop on the back of the wrist. While typically harmless, they can sometimes cause discomfort or limit movement, especially when pressing on nearby nerves. Next is stenosing tenosynovitis, an inflammation of the synovial sheaths on the back of the wrist. This condition can cause pain, swelling, and difficulty with wrist movements. Lastly, carpal tunnel syndrome affects the front of the wrist. It's caused by the overuse of tendon sheaths, which leads to swelling and pressure on the median nerve. This condition is often associated with repetitive wrist movements and can cause numbness, tingling, and weakness in the hand. These wrist disorders highlight the importance of proper diagnosis and management to prevent long-term discomfort or loss of function. Let's go through some quick questions to test your understanding. First question: what is the term for pain in the muscle fibers? The answer is fibromyalgia, a chronic condition characterized by widespread muscle pain and tenderness. Next question: stenosis refers to the narrowing of what? The answer is a narrowing of a passage. Stenosis can occur in various parts of the body, such as the spine or blood vessels. Final question: what do we call the inflammation of a tendon in the surrounding synovial sheath? The correct term is tenosynovitis. This condition is often caused by repetitive use, leading to pain and swelling in the affected area. These terms are foundational to understanding musculoskeletal disorders. Let's discuss the procedures and pharmacology for muscular system. Let's discuss the diagnostic procedures used for evaluating the muscular system. These tests help identify damage, disease, or abnormalities in the muscles. First, blood tests like creatine kinase and erythrocyte sedimentation rate can help detect muscle damage and inflammation. Electromyography involves inserting a small electrode needle into the muscle. This test records the muscle's electrical activity and identifies abnormalities in muscle function. What about measuring how fast motor or sensory nerves conduct impulses? That's done using nerve conduction studies. For detailed imaging, magnetic resonance imaging, or MRI, is used. This can provide a clear view of any muscle damage or disease. Ultrasonography helps visualize tears and inflammation in tendons, providing a less invasive way to detect injuries. A muscle biopsy involves removing a small piece of abnormal muscle tissue with a hollow needle. This can reveal the underlying cause of muscle disorders. Genetic testing is particularly useful for identifying mutations that lead to different types of muscular dystrophy. And finally, MSA, or myositis-specific antibodies testing, is used to confirm a diagnosis of dermatomyositis. Each of these diagnostic tools provides valuable insights into the health and function of the muscular system. Physical therapy plays a crucial role in addressing functional impairments, reduced mobility, and pain caused by musculoskeletal disorders. Let's explore the key interventions used in treatment. Therapeutic exercise have foundational component of physical therapy. These systematic and progressive exercises are tailored by physical therapists to meet each individual's specific needs. Exercises are classified by their purpose, such as improving strength, flexibility, or endurance. Manual therapy involves the therapist using their hands to apply pressure and manipulate soft tissues, helping to reduce pain and improve mobility. Dry needling is a specialized technique performed by certified physical therapists. It uses thin monofilament needles to target specific muscles, relieving tension and pain. Cupping therapy involves the use of suction cups to pull on fascia and muscles, promoting circulation and reducing musculoskeletal pain. Soft tissue mobilization and myofascial release focuses on releasing tension in fascia and soft tissues. By applying pressure with hands or fingers, therapists address tight areas in muscles and tendons, enhancing flexibility and mobility. Instrument-assisted treatments use specialized tools to target dysfunctional muscles, breaking up adhesions, increasing circulation, and improving pain and mobility. Physical therapy provides a comprehensive array of interventions, each uniquely designed to address specific musculoskeletal challenges, helping individuals regain function and improve their quality of life. In physical therapy, modalities are selected based on the specific injury and treatment goals. One common modality is electrical stimulation, used to manage pain. In this technique, electrodes are placed on the targeted area, and electrical pulses are delivered through the skin. These pulses stimulate nerves and muscles, helping to reduce discomfort and improve function. Thermal modalities involve the use of heat or cold to impact the targeted tissues. Heat can promote blood flow and relaxation, while cold is used to reduce inflammation and swelling, offering relief in acute or chronic conditions. Lastly, an ultrasound machine is a powerful tool in physical therapy. It uses sound waves to cavitate cells in the targeted area, creating a deep heating effect within the tissues. This modality helps improve circulation, reduce pain, and promote healing. Each of these modalities is chosen carefully to support recovery and enhance the healing process. It's crucial to understand the elements of a word to grasp its meaning accurately. Let's break down a few examples together. Electromyography. The root elector/o means electricity, my/o means muscle, and the suffix graphy means the process of recording. So, electromyography refers to the recording of electrical activity in a muscle. Inflammation. The suffix ation means process, the prefix in means in, and the root flam means flame. Inflammation is the process of reactions in the blood vessels and adjacent tissues in response to injury or abnormal stimulation. Ultrasonography. The suffix graphy refers to the process of recording. The prefix ultra means beyond, and the root sun/o means sound. Ultrasonography is the process of delineating deep structures using sound waves. Breaking down these terms helps us understand their meanings and use them confidently in medical settings. Let's dive into the role of medications in managing inflammation, pain, and muscle conditions. NSAIDs, or nonsteroidal anti-inflammatory drugs, work by inhibiting two COX enzymes that produce inflammation. These drugs also provide analgesic, or pain-relieving, and antipyretic, or fever-reducing effects. There are three main NSAIDs we'll discuss. First, indomethacin, which inhibits both COX enzymes. While effective, it is associated with several serious side effects. Second, paracetamol, also known as acetaminophen, is not technically an NSAID, but is widely used to relieve minor aches and pains. It's an excellent option for those who need pain relief without the anti-inflammatory effects of NSAIDs. Moving on, skeletal muscle relaxants are used to manage spasticity or muscular conditions by reducing muscle tension and improving mobility. And finally, anabolic steroids are synthetic substances related to testosterone. They've been altered to focus on causing skeletal muscle to hypertrophy or enlarge. While they have legitimate medical uses, anabolic steroids are also frequently used illegally to enhance muscle growth. Understanding these medications and their effects is essential for proper treatment and patient care. Let's discuss the physical medicine and rehabilitation. Let's explore the essentials of rehabilitation medicine and its focus on improving function and quality of life. Rehabilitation medicine is centered on restoring and maintaining function. It addresses a wide range of needs for individuals facing challenges in their daily lives. Restorative medicine aims to restore a function that has been lost. This is particularly important for individuals recovering from injury or illness. Maintenance rehabilitation, on the other hand, strengthens and preserves a function that may be gradually declining. This approach is often used for chronic conditions. Let's talk about activities of daily living, or ADLs. These are the basic, routine activities of personal care, such as bathing, dressing, and eating. And finally, instrumental activities of daily living relate to more complex tasks that enable independent living, like managing finances, cooking, and shopping. Rehabilitation medicine tailors its approach to individual needs, ensuring patients regain or maintain as much independence and quality of life as possible. Understanding the elements of a word is essential for defining medical terms accurately. Let's explore some key terms and their meanings. Amputation refers to the removal of a limb, part of a limb, or any other projecting part. This procedure is often necessary due to trauma, disease, or severe infection. Contracture describes the shortening of a muscle caused by spasm or fibrosis, often leading to restricted movement or joint deformities. Prevention defined as the process of preventing the occurrence of a disease or health problem, highlighting proactive approaches in healthcare. For patients who have undergone amputation, rehabilitation aims to restore mobility and independence, using prosthetics and assistive devices tailored to individual needs. Improve strength and balance through targeted physical therapy and exercises. Prevent complications, such as contractures, infections, or phantom limb pain. Provide emotional and psychological support, addressing the mental and emotional challenges of adapting to life after amputation. Enhance quality of life, focusing on functional goals to enable patients to return to daily activities and hobbies.